Hey everyone, this is Dr. Ryan at Primal Chiropractic, and for our December video blog, we're going to be going over the hip hinge. The vast majority of the patients we treat with low back pain do not know how to hip hinge, and it is a huge reason for creating low back pain. So stay tuned with this video. We're going to be going over it in thorough detail, and hopefully you can start practicing and become a master at the hip hinge. The first step in doing a hip hinge is the setup. So we want to make sure that our center of mass is directly over any object that we're picking up or as close to that as possible. So if I'm lifting up a kettlebell, I would want the midfoot over the kettlebell, and that would indicate our center of mass is directly over it, and it's putting myself in a nice safe position to pick something up. If I'm ever too far away from an object as I attempt to drive and pick it up, it creates what's called shear stress, and you can see how stressful this would be on the back if I pick it up like this consistently. So get your body over or as close to over that object as possible. The second part of the setup is making sure our spine is what we reference to a lot as neutral. We have natural curves in our back, and we want to lock those curves in the whole entire time we're in the down position, all the way till we get up to the top. So if you have anything straight at home, a broomstick, yardstick, etc., practice with this, and it's a good indicator to tell you if you're rounding or overarching your back, or if you're locking it in neutral. What we like to do here is put it on your back. For today's video, just worry about a 2-point reference. It's going to touch your tailbone, and it's going to touch your mid-back. We have a natural curve in our low back, so there should be a little bit of wiggle room with your fingers. Your knees will be soft. We never want to lock them out completely. And again, we shoot our hips back. We want to be able to maintain the 2-point contact, so tailbone and mid-back with a little bit of wiggle room, all the way down and all the way up. What we see a lot with our low back pain patients is they over-round their low back. So it looks something like this. They go down to pick something up, heavy round in the low back. As you can see, a 1-point contact only with the dowel, and we want to have them to maintain that 2-point contact. Just the opposite is possible as well. It's not as common, but we can overarch our low back too much as well. So if we have this heavy arch and we go down to pick something up, it's going to crunch what's called the facet joints in the low back, and we can have some joint damage over time. So we talked about center of mass over the object. We talked about neutral spine. Next, we want to talk about what we reference as the limiting factor on how safe it is to go down with your body. The hamstrings are typically the best limiting factor to tell you how safe it is to get down and back up. So when we go into our hip hinge, if you're doing it correctly, at a certain point, your hamstrings are going to get very tight, and they're pretty much being stretched as much as they possibly can. That is a sign that you really don't want to go too much further down into your hip hinge. Otherwise, the only way to get further down is to now compensate round the low back to get to that point. So when your hamstrings get tight, typically we don't want to go any further into that hip hinge motion, and it's a good reference point telling us, hey, we need to stop going down any further before low back pain starts to happen. Next, we're going to talk about a muscle called the latissimus dorsi, also known as the lats. We want this muscle to be engaged during our whole entire hip hinge because it runs literally across our whole entire back. If this muscle is engaged, it helps to lock that neutral spine in and just keep a safe back throughout the process. A good way to activate this muscle is once we are over our object, we can get our hands on the object, and then imagine yourself having a ball or an orange underneath the armpits and crushing the orange. So packing the shoulder down and tight, that's what activates the lat muscle, locking that spine in throughout the process. We don't want to have a lazy upper body to where we have a heavy round in the shoulder, heavy round in the back. So squeeze that ball underneath the armpit, lock the spine in neutral, and drive up. It's a very safe way to go throughout the hip hinge. Our last cue is going to discuss breathing mechanics. The breath, even though it may not seem like it, has a lot to do with supporting your spine and your core. We want to do what's called diaphragm breathing. This is inhaling deep in through the nose, pulling the breath as low as we can into the abdominal region and expanding throughout this area. We want to avoid what's called chest breathing, where our sternum and our chest is expanding and depressing. This is a dysfunctional breathing pattern, and it doesn't help support our spine and core. So when we breathe in, we want to have a belly full of air ready at this point of the hinge. So when we pull up, we breathe out, and then we repeat. As you go down, we inhale. We have a belly full of air, very strong, very powerful. We breathe out as we come up. And it's just another tool to help lock the spine in, help the core be very strong, and make our body more bulletproof for picking things up and down off the floor. So I hope you enjoyed this video. If you have any questions, I know there was a lot of steps and cues, reach out to us, and have a great day.